In Arizona, many of you probably enjoy activities like biking, baseball, softball, or even running. But before you hit the trail field, everybody, you need to make sure that you stay healthy and injury-free. Dr. Reiner Kremer from AZ Pain Centers is here, and he is going to tell us more about it. Good to see you.
My pleasure.
All right, this is a lot of time that people really love to hike in the evening, not in the heat of the day. But what do you need to think about when you want to kind of get in shape or get ready for maybe strenuous exercise?
Well, as we increase our physical activity, our muscles, tendons, and ligaments are made up of elastic tissue. That elastic tissue has a sliding band within it that if things are tight and not warm, if they're cold, they're more prone to tearing and injury. So one of the ways of preventing injury is by warming up, by doing stretching. If you ever go to a basketball game or a football game or a baseball game, you'll see the pro athletes spend copious amounts of time stretching key muscles to enable those elastic fibers.
Okay, so definitely stretch first. For people who maybe have been injured, I'm sure you see a lot of these injuries. What would you say are the type of sport injuries that are the most common?
The most common are tennis elbow as a result of golf or weightlifting. The other are knee injuries due to running, twisting of the knee, meniscal injuries, and the supportive ligaments, and then back injuries. We see a lot of back injuries, weekend warriors, too much too soon, not enough strength around the joint, and injuries take place.
How bad is running? Because you see, you know it's good for you, as far as cardiovascular, but I heard it can be really hard on the body.
Well, it's repetitive injuries. It's the micro traumas of everyday living that add up. So you want to make sure you've got great shoes. You want to make sure you've stretched. You want to make sure your gait and alignment is appropriate.
Okay, so how can AZ Pain Centers help out if you do suffer from one of these sports injuries?
Well, initially, rest, ice, avoiding the activity is very positive. However, if you haven't responded to doing that, we use non-steroidal and low-dose steroid injections to help relieve the pain, get the function back. We also have a regenerative medicine option where we use stem cells and platelet lysate if there is a tear, let's say in the meniscus in the knee, or if there's a rotator cuff injury. We can use blood products to help heal and restore the function and reduce the pain.
And those are some of your newest options.
They are, exactly. We've been in that space for 2 years. And we are just absolutely pleased with the results we've seen.
Now, the thing is, you, of course, treat people who have sports injuries, but you treat all sorts of pain and pain issues.
Right. We are an ambulatory surgical center where we do a lot of spinal treatment because low back pain is so endemic. It's one of the top 3 reasons that people consult a physician. We also treat neck pain and cervical spine issues as a result of aging or of trauma. We also treat fibromyalgia, headaches, and chronic pain issues.
I feel like I've known you for a long time now. You've been practicing medicine and treating people with these pain problems for a long time.
I have. This is year 39.
Wow.
And we have a great group of physicians with lots of experience and great skill sets at our facilities.
And so you've seen kind of how the issues have changed and the new treatments and kind of stayed on top of all of the latest ways to help people.
Absolutely. In life, there are 2 positions. You either make dust or eat dust. We like leading the pack.
All right, very good. Well, good to see you again. You can get a consultation, everybody, online. All you have to do is go to the website on your screen, azpaincenters.com. You can check out all, of course, their locations and more. You can also go to Facebook or Twitter or pick up the phone, call them at 480-821-PAIN.